Hi, this is Dr. Giamarino at Naples Personal Training with Kevin. We are here today to go over some of the swing faults that will occur in the backswing, transition, and follow-through of the golf swing. So formally, we went over the backswing where the restricted pattern was the lat muscle. Today we'll look at the right hip as a contributing factor to lack of excursion or movement into the backswing. So Kevin, if you would be so kind to get into the address position. And one of the things that you really want to concentrate on is as the club goes back, the toe should be in the up position and the left arm has length. A lot of the swing faults are to quickly bend the wrist to get into the backswing. So we're looking for the left shoulder to come under the chin. And if there's a restricted pattern here, which we would have noticed in an examination, we then break this down and say, is it the left lat, which we did before, or is it the right hip? An exercise to improve this would be for Kevin to bring both legs up into 90-90 and put your fists between your knees. And by moving your feet apart and keeping your knees, you're actively contracting so your foot stays kind of still, and it's just the hips that are moving apart. So it's called a windshield wiper. So both legs come in, both heels touch, both heels move away as you keep your knees up against your fists. As you progress through this exercise, you're now going to come to the sitting position. Put your hands between your knees again, and now you have gravity working against you. So the feet go apart, and you keep your hands there, and you can feel those muscles working in the hip. So once we have done some corrective exercises, found the limitation and corrective exercises, we can then revisit the swing and see if it's improved or not. So left shoulder under your chin, lengthening, and there's a little bit more rotation here. Does that feel a little bit different?
Feels better.
Right. So if it didn't change, and we did have improvement in the hip, then we know it's exclusively up in the upper extremity.